Hello, welcome to the second module update in the effective management of patients with lung cancers in the COVID-19 era series. Today's session is approved for 0.25 hours of CME, CNE, CPE, and AAPA credit. The series is provided by the North American Center for Continuing Medical Education, an HMP company, and is supported by educational grants from Merck and from Pfizer. My name is Corey Langer, and I'll be the moderator for today's program. I'm the Director of Thoracic Oncology at the Abramson Cancer Center and Professor of Medicine at the Perelman School of Medicine at the University of Pennsylvania in Philadelphia. And I am pleased to be joined by Dr. Marina Garestino, Medical Consultant Thoracic Oncology, Med-Onc Division of the National Cancer Institute of Milan and Milano, Italy. And as many of you are aware, she has been in the thick of the COVID crisis. So we'll take 10 to 15 minutes to discuss a topic that she is intimately familiar with, having witnessed really the second major surge in incidence of this virus, and specifically whether our patients, particularly our lung cancer patients, are at heightened risk for corona or the complications if they do test positive, or in fact our outcomes based more on age and comorbidities and factors that are separate from the lung cancer diagnosis. So Marina, if you could weigh in.
Thank you for the question. So what we have now is we have many registries, and the registries are including all types of cancers or only thoracic cancers. Thoracic cancer, there is a registry called TerraVolt, and I think that the majority of the people treating lung cancer are joining this registry, and we have now more than 700 patients in the registry. What we observed from the preliminary results of this registry coming mainly from Europe, so we will have to wait for results or also coming from other realities such as US, Latin American, and the Eastern countries. They suggested that the mortality is 35%, which is 3 times higher compared to the other types of tumors. For example, in ASCO, CC19 was presented, and they reported a mortality, an overall mortality of 13%, so which is highly less compared to the TerraVolt. So what we do not know is that there are 2 things. The first is if the patient with thoracic cancer have a higher chance to get the COVID virus. So it seems from a meta-analysis that in general, the patients with cancer, they have higher risk of infection compared to the other patients. So what we don't know is if lung cancer patients are at higher risk compared to all the other patients. What we know is that they have higher risk to die. We don't know if this is based to the fact that the thoracic patients are with more comorbidities, are with an older age compared to the other tumors, and maybe are in a worse condition in general compared to the other tumors, or if for several reasons the thoracic cancers are at higher risk of mortality by themselves. So, but anyway, the mortality is higher, and we must be very careful with these patients. So I think that we must educate our patients with the social distances or physical distances, as you prefer, and also to wear masks, to educate also the parents, the relatives to wear masks and to be protected if they live with the patients with thoracic cancer. So I think that the protection is still the most important factor for these patients in order to avoid that they have the virus. What we learned with the registry is that maybe not all the patients with thoracic malignancies are the same. It is possible, for example, that small cell lung cancer and non-small cell lung cancer are worse compared, for example, with thymic malignancies, but I think that we need again more numbers. So it's important to join this effort to have some answers. And what we learn is that the patients on chemotherapy potentially are at higher risk to have a severe COVID compared to, for example, tyrosine kinase inhibitors or immunotherapy. So I think that the situation is heterogeneous, and maybe we have to have a different attitude with different patients.
Are you routinely testing your patients now before they start immunotherapy or chemotherapy or the combination? Are they getting nasal swabs, and are you also looking at antibodies?
Yeah. So, you know, I live in Milano. In Milano, we still have a lot of patients with COVID. So you have a chance to really have the COVID. So I think that in these areas where you have a huge and high possibility to be positive, it is important to test with the swab and with the antibodies the patients. So, but maybe if you live in a country where the surge is not so high like in my country, maybe social distances and to trace contacts, it's enough. So I think that there is not one recipe for everyone. So we have to personalize also the testing and also the antibodies according with the surge and also with the shortages, because for example in my countries there was a period where it was impossible to test everyone. So maybe in Brazil there is this problem now.
Brazil, and certainly in some parts of the United States, which still haven't even seen their first peak. We're seeing numbers rise, in part, I think, because the physical distancing has grown lax. How have you reintegrated your patients back into the clinic setting? I know initially it was just a matter of maintaining them, but now in terms of therapy, what kind of accommodations have you made or alterations in their treatments?
Well, we started to have the first wave in the end of February. So it's 4 months that we are in this situation. It was terrible in March and April. Now the things are really improving very quickly. So in the beginning, we were totally terrified and we stopped everything. So we stopped surgery, we stopped screening, we stopped therapies. So we stopped everything because we thought that it was very dangerous for patients coming to the hospitals. Now we are starting to live with the virus. So the patients are normally coming to the hospital. We test, we avoid the patients with the fever, so we test for the temperature. When they are in the entrance, that we give masks to all the patients. We avoid too many patients. So I live in a country where when you visit a patient, you have all the family in the clinic. So now there is only the patients. So we try to protect the environment and not to have many people in the same room, and in the same room we have 2 meters from the healthcare workers and the patients. So we created a different environment than before, and we started to do a lot of telemedicine. So for example, for the tyrosine kinase inhibitors, we ship the drugs to the home of the patients, and we do the blood exams at home, and we stay in contact with these patients. I think that this is something that is it is strange because we love to see the patients, but I think that the patients understand that maybe not coming so often to the hospital can protect them. So I think that there is a learning curve on how to live with the virus, And I think that one thing is very crucial is to protect the oncological department and to try to create as much as possible a clean environment for continuing to treat the patients as before.
We do pretty much the same. We temperature check, infrared monitoring, and not just patients, but their family members and, of course, staff when we come into the hospital. We put those temperatures on masking tape on their clothes. We have immediate Purelling before they even enter the facility. At one point, we had patients alone in the examination rooms. We are now allowing one family member, but no entourages, no big parcels of family. And I agree with you, it's very hard. As part of our profession, the human part really requires a lot of close contact and, you know, whether things are going well or poorly, hugging our patients, and it's awful difficult not to do that under these circumstances. But at least for the time being, our hugs have become virtual. And you know, it's a necessary part of the current reality. So I really appreciate your comments here, both from a medical perspective, but also from a human perspective. So thank you all for joining us in the program today. If you have any questions, please submit them in the Submit a Question tab located on the right-hand navigation bar. One of our expert faculty will respond to your query. And to receive your CE credit for today's program, please complete the evaluation located on the right-hand navigation bar. You will then be able to download or print your certificate. Please join us next week when we launch the third module in this series, a 15-minute lung tumor update. And again, once more, thank you for joining. And thank you, Marina.